Hello everyone, my name is Neutrophil. Within the white blood cell family of army, I am the undisputed frontline infantry, the first responder, and the backbone of your innate immune defense. I belong to the granulocyte division because my cytoplasm is packed with tiny pale lilac granules containing powerful chemical weapons. If you look at a standard laboratory report, I am the absolute majority force. I make up 60% to 70% of your total white blood cell count. I am manufactured in massive quantities inside the bone marrow every single day. Why do you need so many of us? Because we are the very first cells to rush to the scene whenever your body encounters an acute bacterial infection, a physical cut, or tissue trauma. We live fast, fight hard, and usually die in battle within a few hours to days. The infantry weapons. How neutrophils fight. I do not wait around for a smart immune response or specific antibodies to be built. The moment bacteria breach your skin or mucous membranes, I deploy an aggressive three-pronged tactical attack to neutralize the threat immediately. 1. Phagocytosis, the feeding frenzy. Just like my cousin Max the macrophage, I am an avid eater. When I arrive at an infection site, I lock onto the invading bacteria, wrap my cell membrane around them, and swallow them whole into a fluid bubble called a phagosome. I then fuse my internal granules into that bubble, releasing destructive enzymes like lysozymes and hydrogen peroxide to dissolve the bacteria from the inside out. 2. Degranulation, the chemical blast. If there are too many bacteria to swallow individually, I unleash chemical warfare. I open up my granules and spray powerful antimicrobial proteins, defensins, and enzymes directly into the surrounding tissue space to kill nearby pathogens on contact. 3. NETs, neutrophil extracellular traps, the kamikaze mission. When the battle is overwhelming and I am about to die, I execute my ultimate secret weapon, netosis. I violently rupture my own cell membrane and eject my own DNA structure into the tissue space, spraying it out like a sticky web. This DNA web is laced with highly toxic antimicrobial enzymes. It physically traps and kills wandering bacteria, preventing them from escaping into the bloodstream and spreading throughout the body. The meaning of PUS. Because we fight so aggressively, a single neutrophil can usually only swallow a few bacteria before its internal programming triggers cell death. The nursing connection. When millions of us rush to an active infection site, fight the bacteria, and die together, our accumulated cellular bodies, mixed with digested tissue fluid and dead bacteria, form a thick yellowish-white fluid. In clinical practice, you know this fluid simply as pus, scientifically called purulent exudate. Seeing pus at a wound site is a direct physical sign that my infantry division is actively on the front lines fighting an infection for your patient. Critical nursing labs, the CBC, and the left shift. To track how hard my infantry unit is working, you will look closely at the complete blood count, CBC, with differential. There are two critical concepts you must master for your nursing exams. 1. Understanding segs versus bands. When a pathologist looks at us under a microscope, they categorize us based on how mature our nucleus looks. Segmented neutrophils, segs. These are fully mature, grown-up neutrophils. Our nuclei are neatly pinched into 3 to 5 distinct segments, which is why we are also called polymorphonuclear leukocytes or PMNs. We are fully trained and ready to fight. Band neutrophils, bands. These are young, immature teenage neutrophils. Our nuclei haven't segmented yet. They just look like a solid curved U-shape or an indented band. We are clumsy and not nearly as effective at fighting yet. 2. The shift to the left. On a normal day, almost all the neutrophils circulating in your patient's blood are mature segs, with maybe only 0% to 3% being bands. However, if your patient develops a severe acute bacterial infection, such as acute appendicitis, a severe UTI, or systemic sepsis, my supply chain in the bone marrow panics. The bone marrow works overtime and begins throwing cells into the bloodstream before they are fully grown, causing the percentage of immature bands to spike dramatically, above 10%. Exam tip. On classic laboratory charts, these immature bands were printed in the far left column. Therefore, seeing a high number of bands on a CBC is called a shift to the left. If you see a left shift, it tells you immediately that your patient is fighting a severe acute bacterial infection. Remember to like, share, and follow this account. If you have a question or a topic you would like next, let us know in the comments section.